Yay.
Rolling.
The values that really matter at NHS Providers are some values that we've developed.
Being collaborative,
inclusive,
respectful,
and also about being really effective.
and I can feel that every day.
I don't think I've ever worked with a team that is so committed to what they do.
We want to let our members know that we have their best interests in mind.
And we're committed to being the best that we can for the members that we represent.
We represent all NHS trusts across the English NHS, and that's in all sectors.
Acute hospitals, mental health trusts, community services and ambulance services.
What NHS Providers does is we champion and support our members and their work,
And we're here to be the voice of those organisations.
influencing on their behalf to really represent their concerns, issues and views at the highest levels of government, but also to bring members together to support one another in challenging times. There'll be a significant amount of interruptions.
Well, we know it's an incredibly pressured time across the NHS. We seek to keep members really up to date with all developments across the health and care sector.
We set up interviews, we write press comments, we write op-eds for newspapers and for websites.
We need to ensure there is a positive narrative about what NHS trusts are doing to combat the major challenges that they are facing.
What we do know, and what trust leaders who are members of my organisation are focusing on, is how we minimise the impact on patients.
One of the best things about NHS Providers is that we're reliable, we're authoritative and we're credible.
Having worked in the clinical environment myself, I would say that the value that we bring is instrumental.
And a lot of it is focused around gathering the data on what's really going on in the front line.
We cover a wide range of topics across pensions, pay.
From cancer waiting lists to elective care to A&E and ambulance services, for example, from all hospitals across the country.
One of the key things for us that's really valuable for members is the on-the-day briefings that we do. Having kind of the top lines and key messages up front is really crucial.
The data that comes from surveys is really important. We are very reactive when something new comes along. For example, strike data. The moment these data started being published, we created an analysis program for it. Our members really valued having that information.
One of the core values of NHS Providers that's really important to me is inclusiveness.
And not being able to be yourself at work or be your whole self at work can be really detrimental.
I'm the chair of the Race Equality Cultural Inclusion Group.
I'm the chair of the Mental Health Network.
I am the chair of the LGBTQ+ network.
Half the battle is getting people willing to talk about mental health in the first place.
It's really important to have that space where people can come together and foster inclusiveness.
We believe that if we're an inclusive organisation, it sets precedents and standard for our members to see that inclusiveness is important. Inclusiveness does increase retention. Inclusiveness does also increase the well-being of staff.
Just that open culture of talking has been something that I'm really proud of hopefully helping to cultivate.
It's really important that we support our members in their development goals. Obviously, the pressure that there is on boards on quality, governance, finances, on operational performance, on digital transformation. Now, in all of those areas, we're very active in helping support our members.
We hold both virtual and face-to-face network events, and these events are a safe place for trust leaders to influence, to learn, to share good practice. We have 12 member networks. We recently had our Chairs and Chief Executives network. We also have HR directors, strategy directors, community health leads, mental health leads, so all of those kind of like board level, executive and non-executive director level roles. We have over 98% of trust leaders saying they would definitely attend another network event, and these events are part of your core membership, so I wouldn't miss the opportunity to attend. It's very cliche, but the best thing about working for NHS Providers is we're all striving to work towards the same goal.
The real focus for NHS Providers is, at the end of the day, to make sure that we support our trust to deliver the best quality care that they can to patients and service users.
And we just want to make sure that that trust is really cemented in our organisation.
We see people going above and beyond all of the time, and I think there is a real pull, knowing what's going on for our member trusts on the front line, to be able to support them as much as they can.
My message to our members, all of whom are doing incredible work at tough times, is that we are here for you, and we are here to support the work you are doing to genuinely transform opportunities and roles for staff and really deliver the kind of care that we know we all want to deliver for our patients now and in the future.